Hi, Katharina. Good to see you again.
It's so good to see you too.
So I see that you're interested in a head-to-toe assessment today.
Yes, unfortunately.
So what brings you in? What's happening?
I've been having feverish symptoms and a little bit of like stomach ache going on.
When did the fever begin?
A couple hours ago.
Okay. I can definitely tell that, yes, you are a little bit feverish. Not too much, but you are definitely hot. Okay, and tummy ache?
About the same time, but my stomach has just been a little sensitive since I got my Invisalign. I haven't been able to chew as well because my bite is off. And I think that I'm not chewing my food enough, and that's causing me like acid reflux and a little bit of pain. But I thought I would get checked out by you because of the fever symptoms.
Have you been exposed to anybody who has been sick recently?
Not that I'm aware of.
Okay, so nobody in your household running a fever or a runny nose or anything?
No.
Okay, have you been traveling outside of the country?
No, not in the last 6 months.
Not in the last 6 months. Okay. Other the Invisalign, have you made any changes to anything? Not like your diet or how you're exercising, how often?
I just started eating meat again.
Eating meat, okay.
I do make sure that it is farm fresh if I do. But I think it's been a little bit hard on my stomach, if I'm being honest.
Okay. Any runny nose?
No.
No runny nose. Any headaches or aches?
I do get minor headaches. I think once again it's a factor of the Invisalign treatment.
Okay. Any joint pain?
No. No joint pain.
Any shivers?
A few, yes.
Okay.
I do get a few hot and cold flashes here and there. I'm not sure what that's about, but I think it's part of the fever.
Are you allergic to any medication? Any new allergies popping up?
I think I had a reaction to hydrocodone the other day, and I was only taking it because I was just not feeling well. And it backed me up a little bit.
Okay. And was that reaction severe or mild?
Was just nauseous for a day.
Nauseous for a day. Okay, so those two could be associated. I mean, the tummy ache and the reaction to hydrocodone. Okay. Have you had any recent vaccines done?
No.
Okay. All right, let's go ahead and check you out and see if we can get to the bottom of what's happening.
I really appreciate it.
Okay. I'm gonna go ahead and put my gloves on. This video is sponsored by Dosier, a company that sells premium quality, ethical, affordable perfume for all. Say yes to smelling good and no to overpaying. I recently got a couple more perfumes from Dosier because I love them so much. I got the Aquatic Peony, inspired by Armani's Acqua di Gioia, which retails for $98. Dosier only charges a fraction of that cost for the same exact scent. I also got the Fruity Almond, a feminine smell which combines joyful peach and almond with the rich floral bouquet of tuberose and orange blossom. For him, I also got the Woody Ginger, an earthy yet full of vibrant scent, inspired by Tom Ford for Men, which retails for $84. Get it here from Dosier for so much less. Dosier also sent me their Ambery Cedarwood, a sweet, succulent take on jasmine inspired by Muller's Alien, which retails for $150. This scent is my absolute favorite out of all of them. I use it almost every day. Dosier was also kind enough to send me their Gourmand White Flowers Room Diffuser, that I use in my filming room to keep the air smelling fresh, clean, and satisfying during filming sessions. Dosier is doing their best sales of the year with up to 55% off an entire range of perfumes. Click on the link in the description down below and use code LUNALAX10 for 10% off. You will get premium products at incredibly affordable prices. Any body aches or pains right now?
I do have a little bit of like lower back pain going on, but my back has always been sensitive. I am a runner, and my back gets a little bit of a ache after I run.
Okay, so I'm definitely going to make sure to check out your back as well, but let's begin with the vital signs. I'm going to take a listen at your heart and your lungs and see if I can hear any crackling, any signs of anything, happening with your lungs and your heart.
Thank you.
All right, so just go ahead and breathe normally. Okay, take a deep breath in for me and out. Okay, you can just breathe normally now. So, heart and lungs are okay. I'm not able to hear any crackling, no hissing, no signs of any pneumonia, bronchitis. That's all good. Let's go ahead and check your temperature. Okay. Is it okay if I place this device under your tongue? Yes. Okay, just go ahead and close your mouth and try to keep it right there for me. And I'm also going to check the levels of oxygenation and your heart rate. So go ahead and relax. Okay, so yes, I am seeing that you're running a little bit of a fever, 99.9. And 99% oxygenation, which is good, and a little bit of an elevated heart rate that could be associated with the fever. Okay. So let me just go ahead and make a note of these findings. And you said the fever only started a couple of hours ago. Okay, so you've not noticed anything yesterday or last night? No hot flashes, nothing of the sort?
I had a little bit of a hot flash last night, so I think it might have been onset.
Oh, okay. I'm gonna set this aside. Go ahead and check your eyes.
Okay.
Go ahead and look in the distance for me. Just going to check your pupil response. Good, and now I want you to look into my eyes. I'm going to check the direct and consensual response as well. Good, perfect. So pupils are reactive to light. They have the normal size and shape in room temperature, as well as when I place my more powerful light into your eyes. So I'm not concerned. Okay. Let's go ahead and just feel your head. I'm going to palpate and check for any lumps and bumps, any pain that is particularly more intense when I'm touching you. I want you to stop me and let me know.
Okay.
The back of the head, any pain right here?
No.
Okay, touching the mastoid bone process behind the ear. Any pain here?
No.
I'm going to apply light pressure. Any pain here?
No.
Laterally and diametrically. Any pain here?
No.
Okay, I'm going to just push your head down, so I want you to resist. Good. And I'm going to attempt to bring you forward. I want you to resist. Perfect. So strong muscles in the back. Okay. I'm going to palpate your arms and your clavicles and move my way down. And again, if you feel any sharp shooting pain, any tenderness when I palpate your lymph nodes especially, stop me.
Okay.
All right. I'm going to start with the neck area. Just feeling on all of the important meridians, checking for any inflammation, any nodules. Starting with the preauricular and postauricular lymph nodes, occipital, and the cervical lymph nodes on the neck. Please move your head towards your left side. Over on this side. Okay. I'm not noting any enlargement of the lymph nodes. The neck lymph nodes are mobile, barely palpable. Okay, I'm going to check your supraclavicular lymph nodes. Not able to feel them. That's good. Okay. Let's go ahead and move your arm slightly to the side so I can take a look at the axillary and pectoral lymph nodes. Okay. Usually when our body is reacting to an infection, these are amongst the first lymph nodes that are getting inflamed. Not able to feel them here. Let's check out your left arm. Okay, the axillary. Good. Okay, so lymph nodes are looking okay. I'm going to go ahead and just palpate your arms. Checking for any edema. So going to inspect them. Okay, checking for any discoloration. You can just lift your arm just over and hold it pressed. That. No discoloration. Okay, that's good. To palpate it and feel it. Any pain or tenderness here?
No.
Okay. Good. And elevate your arm for me parallel to your head. Okay. No discoloration noted. That's wonderful. Okay. I'm going to go ahead and check in the back of your throat for any tonsillitis, any signs of any infection. Do you have a sore throat right now?
No, not really.
Okay, can you swallow for me? Good. Go ahead and open your mouth. Say ah. Okay. So not seeing any signs of infection, inflammation. I do see the Invisalign, which is looking like it's fitting perfectly. Okay, good. You can close your mouth now. Wonderful. Have you noticed anything abnormal with your ears? Any tinnitus? Any abnormal sounds? Ear aches, or pressure in the ear, especially when you touch yourself? Anything bothering you with the ear?
Yes, so I've been struggling with tinnitus for the last 5 years.
Okay.
ASMR really helps for that.
It's a good solution.
Yeah. But yeah, I suffer with a lot of ringing in the ears, and I think that right now I actually do have some earwax.
Okay.
So I'd like for you to let me know, and maybe we can do an ear cleaning in the future.
Sounds good. Okay. Go ahead and look towards your left. I'm going to go ahead and just inspect the outside of the ear first and see if I can spot any discharge, discoloration. Okay. The outside of the ear auricle looks good. I'm going to go ahead and check the tympanic membrane. I do see a little bit of earwax buildup, and I'm able to spot the tympanic membrane, the eardrum. I see a pocket of a little bit of yellowish discharge, which looks like earwax. But there is also a pocket of a little bit of a reddish discharge. It does not look too good. I'm assuming that there may be a little bit of an infection going on in this ear, just the beginnings of it. So it's good that we caught it. I can prescribe you some mild antibiotics. A broad spectrum antibiotics like amoxicillin should just clear this up.
Oh, thank you.
Okay, let me go ahead and look in the other one as well. Okay, go ahead and look towards your right, please. Going to inspect the ear auricle, which appears clean, pink, slightly moist. Does this hurt?
No.
This?
No.
Okay, no signs of any discharge, no inflammation, no build up around the ear auricle. Let me go ahead and check the tympanic membrane ear canal. Okay, I'm able to see the bony landmarks of your inner ear, not spotting any buildup of wax. And I can see the eardrum pearly gray, well-defined margins. No sign of any cerebral fluid buildup. And no signs of any infection or inflammation, so that's very good. Okay, go ahead and close your eyes. I'm going to do a quick hearing test just because I'm able to spot so much buildup in this ear, so much more than on this other ear. So keep your eyes closed and tell me if you hear a sound in your left ear or your right. Maybe just point towards the sound. Good. 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 One last time. Okay, that's very good. So your hearing is intact, which is indicative of the fact that Now the buildup is not too much and it's not causing any problems, but if we do let this ear infection progress, then we may be getting into a dangerous territory. So I will prescribe some amoxicillin for you. Go ahead and write this down right now. And I want you to take it for about 5 days, every 12 hours, 1 pill. Good. All right. I'm gonna check out your nose next. Any pain in your nose, any discharge, any sneezing, especially repeated sneezing?
I sneeze about 4 times a day, just probably because of like allergy season.
Okay. Is the sneezing accompanied by any pain?
No.
No. Okay. Just go ahead and just move your nose a little bit and check the range of motion. Okay, good. Any pain here?
No.
Okay. I'm gonna go ahead and just palpate. Oh, are you about to sneeze?
No, I was yawning, I'm sorry.
That's okay. Okay. You have a very straight nose. I think you have the straightest nose I have ever seen in one of my patients, in any one of my patients. Very, very straight. Okay. I'm gonna go ahead and give you something to smell. And let's just check out whether you can smell. I'm going to obstruct one of your nares. What does that smell like for you, Katharina?
Peppermint?
Good. All right. Okay. So what I'm going to do next, Katharina, is check out your dermatomes on your face, your chest, and your arms. And dermatomes are area of the skin that are innervated by the same spinal nerve root. And if they are damaged in any way, that could be indicative of nerve damage. So I'm going to go ahead and test your dermatomes. So keep your eyes closed. And we are going to do a test that is called sharp or dull. May I have your palm, please? Do you feel this?
Yes.
That is dull. And do you feel this?
Sure.
That is sharp. Okay. So go ahead and say sharp or dull.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp.
Okay. And I have here a point pressure device. I want you to keep your eyes closed and say yes when you feel it.
Yes. 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 Yes.
Okay. So I checked your ears, your eyes, your nose, your mouth looks okay. Vital signs, the only red flag is the fever that you came in with. Let's go ahead and take a look at your tummy. So I want you to lay down and see if I can detect anything that could be indicative of any digestive problems, any muscular problems. Okay. Is it okay if I lift up your top and lower your skirt a little bit, Katharina?
Yes.
Okay. Let's see if I can do this. And trying to expose the central part of the abdominal cavity with the belly button, liver, spleen, stomach, kidneys, intestines. Okay. Right. So I'm going to begin by listening to the internal sounds of your cavity. Go ahead and just breathe normally. Okay. I'm listening for any gurgling, swooshing sounds. Anything that may indicate an intestinal obstruction. Okay. I'm hearing activity in all four quadrants. And no swooshing or gurgling sound. Okay. So that checks out. I'm gonna go ahead and put my stethoscope right there. And I'm going to remove my gloves. I'm going to begin by doing a light palpation. Checking for any nodules, any masses. Not able to feel anything abnormal. The spleen is not enlarged. Any pain when I press down on the belly button?
No.
Okay, good. Okay, go ahead and elevate your legs a little bit. Okay. Just bend them for me, yes. And that is so that your muscles are not putting any resistance. I'm gonna try to feel the tip of your liver. Okay, which is not enlarged. Good. Okay, very good. Alright. Going to do just a percussion. Go ahead and breathe normally. good resonance. Nice and dull. Good. That's what we want to hear. Good. Okay. So abdominal cavity sounds perfect. Good. Okay, you can lower your legs now and relax them. Go ahead and measure your belly button. Check for lateral longitudinal symmetry. 2.2. 2.2, perfect. Okay. I'm gonna check the skin. Couple of moles, well-defined margins, one color. Good. Skin looks healthy. Gonna go ahead and do the same sharper dull test that we did on your face, over on your abdomen. So go ahead and say sharp or dull.
Dull.
Good.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull.
Very good. I'm gonna go ahead and do light acupressure and relieve some of the abdominal tension that I believe may be contributing to the symptoms that you're experiencing. I'm not able to find anything physiologically wrong, so I believe the tummy problems may be muscular in nature. let's go ahead and focus on your legs and your feet next, Katharina. Okay, I'm just checking for any signs of edema by palpating your calves muscles. Ankles look okay. Okay, no signs of edema noted. Do you feel that?
Yes.
And that?
Yes.
Just say yes when you feel it.
Yes. 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 Yes.
Okay. And go ahead and tap on your calcaneus bones. Any pain here?
No.
Okay, good. And can you rotate your right leg? Good. And the other way? Perfect. Now can you push into my palm? Good. Rotate your left leg and foot the other way. And now push into my palm. Perfect. Okay, I'm gonna go ahead and inspect your toes. In between the toes. Capillary refills in 2.5 seconds. Good. Checking in between the toes again. No nail clubbing or pitting noted. With healthy capillary refills in 2 seconds. Good. Actually, can you curve your toes over my pen light? Okay, good. And the other one. Curve your toes, wrap them around. Perfect. Okay. I'm also going to do the Babinski test. Okay. Good. And over on your right leg. Perfect. Negative Babinski. Alright. Do you feel this?
Yes.
And this?
Yes.
And this?
Yes.
This?
Yes.
Good.
Yes. 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 Yes.
So dermatomes in the legs and feet are healthy. Okay, do you feel any pain here?
No.
Okay, any pain here?
No.
Any pain here? Here, good. And any pain here?
No.
Here?
No.
And on the pinky?
No.
Good, okay. Let's go ahead and flex your leg. Any pain there?
No.
Okay. Let's flex the other one. Good. No pain. Perfect. Alright, let's go ahead and stand up so I can take a look at your back. Is it okay if I clip your hair up into a ponytail, Katharina?
Yes.
Right. And is it okay if I unbutton your gown?
Yeah.
Just going to feel your back first. And I can sense that you are a little bit feverish. Even distribution of your temperature. I'm not feeling any indentations or any other inflammation on the skin. I'm going to go ahead and listen to your lungs. Just breathe normally. Take a deep breath in and out. Deep breath in and out. Okay. Go ahead and breathe normally. And I want you to whisper 99. One more time.
99.
One more time. 99. Good. I'm not able to hear through the stethoscope. Good. Okay. Going to percuss your back. Good. Okay, let's do a sensations test as well. I'm going to slide a slightly cold object down your spine, and I'm checking for any abnormalities in your nerve endings. Okay. Just a slight reaction, so we're going to try that again. Okay. No abnormalities are noted. Do you feel that?
Yes.
Okay. And this?
Yes.
Okay, can you tell me if it's on the left side or the right side of your back that you feel the sensation on?
Left. Left. Right. Right. Left. Right. Head. Middle.
Perfect. Okay. And do you feel a sharp sensation?
Yes.
Okay, just say yes when you feel it. when you feel it stopping.
Yes. 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 That will give me all shivers.
Okay, let's try that again. Okay. Then let me inspect the top of your neck, around your cervical spine. Any pain here?
Not at all.
Not feeling any nodules or masses. I can feel in between the vertebrae from C1 to C5, so nothing is concerning. Okay. I'm gonna go ahead and button up your gown. And let's discuss the result. Katharina, this concludes the head to toe assessment for today. You came in with a little bit of fever. I'm still able to sense that you are feverish. I'm not able to find anything else physiologically wrong with you. I don't think that, there's anything going on with your tummy or your back. You seem perfectly okay. So let's see how the fever progresses in the next couple of days, and if you get any new symptoms. I'll wait for you here again.
Oh, thank you so much. I appreciate it.
Oh, thank you too.